On our last video, we talked about the two ways to generate revenue for your practice post-COVID. The first is to offer new services to your present patient population so you can increase your average per patient revenue. The second option is to offer new services that will attract the high value patient to your practice and increase your revenue that way. If you're considering a new service, you should think about a service that you can now delegate to your staff so that your staff can become a profit center for your practice. You see, your staff are a vital part of your organization. They make appointments, they prep rooms in advance of seeing patients, they clean rooms afterwards, they might help with billing or follow-up appointments. They do all the things necessary to keep patient flow moving at a maximum so you can efficiently work as a doctor in your practice and generate the revenue you're looking for. But they are a cost center. They don't typically generate revenue. With the new services that are available, you can now change that and bring in new services that will turn your staff into a profit center. These new services allow your staff to treat patients independently based on your diagnosis, and in this way, they're able to duplicate your time and income. They can be in room A, treating a patient, taking care of that patient, generating revenue, while you're in room B, doing the same thing. Or you're in a surgical center, or if it's a day off. Either way, they're duplicating your time and income. This is a strategy you'll want to take a look at and start to implement because your staff can generate significant revenue for you. We've seen staff generate anywhere from $40,000 to $75,000 for a practice that sees typically 80 to 100 patients a week. If your patient population is patients that are in pain, they have muscular skeletal pain, inflammation, arthritis, maybe you see patients that have neuropathy, or if you're a surgeon and you're interested in speeding the post-op healing and taking away some of the pain and inflammation from those patients, then I'd love to talk to you about some of the services that are available for your practice. These new technologies will allow you to generate revenue faster than anything else that's available to you. Too many doctors are trying to work more hours, see more patients to try to offset the losses due to COVID, and you simply can't catch up that way. The only real way to move forward is find an additional source of revenue in your practice, and that can be your staff. Your staff duplicating your time and revenue generation. That is the way to go. If you're interested in learning more about which technologies are available to your practice to generate significant new revenue by delegating that to your staff, happy to have those conversations. You can reach out via phone or respond back to this email. I'm happy to set up a time to talk. I hope these videos help, and as always, here's to your continued success. Take care.